Our case today involves a lorry driver struggling with something personal. Picture this, you're consulting Mrs. Smith, 62, who looks slightly embarrassed. Doctor, I've been struggling with my bladder. I have to strain and I'm up 3-4 times a night. I'm exhausted and it's affecting everything. Mrs. Smith complains of lower urinary tract symptoms, hesitancy and nocturia. In this video, I'm going to guide you through the key areas to focus on and some practical tips that will help you feel confident when assessing and managing lower urinary tract symptoms. Alright, let's talk about a common pitfall that often trips trainees up in consultation. The first big pitfall is being disorganized. Trainees often forget to ask questions and find themselves gathering data in clinical management. For example, forgetting to ask about the use of caffeinated products in the first half of the consultation, then having to ask it afterwards. Structuring your consultation will help you take a systematic history. Consultation models like Neighbor or the Calgary-Cambridge provide a logical framework for data gathering. It is helpful to learn a few of these models and develop your own consultation style. Here's an example of a consultation framework for the SCA. Start with open-ended question and get the patient to tell the story. You might ask, could you tell me from the beginning how it started? This gets the patient to talk about what's been going on and gathering a broad picture. Once the patient tells you the narrative, encourage the patient to tell you more. In data gathering, there are 3 buckets: patient's health agenda, ideas, concern, expectation, the biomedical history, and then the psychosocial situation of the patient. Most trainees are really good at taking a biomedical history, but they tend to neglect health agenda or the psychosocial. When you think about these 3 buckets, then it helps you to organize the information and make sure that you're progressing. The second pitfall that trainees make is not using the existing information. Let's say you have a patient who has seen a colleague last week for the same issue or has a history of conditions like diabetes. This could be relevant. If you skip over this, you're missing valuable context that could shape your consultation. A simple tip is to take a minute before the consultation to scan through the patient's notes. Look for recent visits, medications, allergies, or relevant medical history. This small step can reveal important details like the alcohol intake or recent medication change, which can significantly impact your assessment and management decision. Priming your case beforehand is going to set you up for success in the consultation. Trainees often ask questions that appear to be random or miss a mark, making it hard to safely assess a patient's condition. So what's the fix? Instead of trying to ask every possible question under the sun, focus on covering the key red flags and relevant symptoms. For prostate problem, think about lower urinary tract symptoms. So these fall into 3 categories: storage symptoms like urgency and frequency, voiding symptoms like hesitancy and weak stream, and post-micturition symptoms like dribbling or feeling like you haven't fully emptied your bladder. So take a targeted history and focus on the relevant red flags. For example, weight loss, problem with an erection or any blood in the urine, or back pain. Be curious about the impact of these symptoms on the patient's life. Are they affecting their sleep, their work, their relationship? This isn't just about ticking boxes. It's about understanding how the symptoms are affecting the person in front of you. When you ask personal questions, signpost your question. So tell the patient, I'd like to ask you some sensitive questions to help me understand this problem. So then the patient anticipate that you might be asking some personal question. It's vital that we don't forget considering the whole patient. That's a physical, psychological, and social context. Prostate issues aren't just about physical symptoms. They can significantly affect a person's mental health, relationship, and daily life. So take a moment to ask about how the symptoms affecting them beyond the physical aspect. Are they feeling anxious? How has this problem impacted on the work? For example, with Mrs. Smith, if he is a lorry driver, then it could be very disturbing if he's having to stop at various service stations or is desperate for a toilet break. This broad understanding helps you create a management plan that's tailored to the patient, not just a condition. A common pitfall trainees make is narrowing down a diagnosis too quickly. So when you're forming your list of differentials, make sure that you're considering various pathologies so that you're not missing something like a prostatitis, bladder cancer, or even a neurological condition. Ask yourself, what else could this be, and test the possibilities systematically. This approach ensures that you don't miss anything serious and keep your clinical reasoning sound. Next up is investigation. We've all seen it. Some trainees might order a battery of tests just to be on the safe side. But not all tests are necessary, and some can even confuse things more. The key here is to request investigations that are targeted, relevant, and that actually answer a clinical question. For example, if Mrs. Smith comes with lower urinary tract symptoms, you might consider offering a PSA level, so blood test for the prostate-specific antigen, but you probably don't need to request more investigations. However, if you suspect a urinary tract infection, you may consider urine analysis to exclude a UTI. Always ask yourself, what's the clinical question I'm trying to answer with this test, and how will this result change my management? When you're discussing the blood test for a PSA level, make sure that you explain it in a layperson language. Sometimes trainers over-explain the PSA and give too much detail and use excessive jargon. So for example, they might say this test is not accurate because there's also false positive and false negative. Although you're giving good information, but for a patient, it might not be adapted. So you need to explain it in a simple language. So using words like false positive or false negative might confuse a patient. So a simple way of explaining the prostate-specific antigen, it's important that we investigate to exclude anything serious with the prostate. And there's usually a blood test that we would offer. It's called a PSA blood test for prostate-specific antigen to check a marker of the prostate. Now, the test in itself is not perfect, but in combination with examination of the prostate, it helps us to get a better picture of what's going on with the prostate. So there are things that can affect the results. For example, any ejaculation or any vigorous activities 48 hours before the test, so we'd avoid this. If you are happy for me to arrange this, we could arrange this blood test, and then we can discuss the results in a week time. See, like, you don't have to use too many jargons and complicate an explanation. If you'd like me to do another video where we go over how to discuss an abnormal PSA level with a patient, then let me know down in the comment section. When it comes to the management, it's important that we take into account what the patient has said in the data gathering. So for example, if a patient drinks a lot of caffeinated product, for example energy drinks, then we can advise a patient about the impact of energy drinks and how it can irritate the bladder. So considering reducing that might help with the symptoms. Then when we look at medical management, it's important that we treat the patient accordingly using the guidance. So for example, if we're treating a patient with enlarged prostate, it's really important that we go through the first line unless there's any contraindication. Some trainees might confuse finasteride and tamsulosin and not be sure which one to prescribe. So make sure that you're up to scratch with the knowledge base. And when you prescribe a medication, make sure that you explain the pros and cons of the medication so the patient can make an informed decision whether they'd like to take the medication. So let's go back to Mrs. Smith, who we think has got benign prostatic hyperplasia. When it comes to explanation, it's important first to establish the patient's pre-existing knowledge. So for example, you might ask Mrs. Smith, what do you know about the prostate? And if the patient doesn't know much, then you can explain the prostate is a gland that sits underneath the bladder, and with age it grows larger. So when it grows larger, it can disrupt the passage of urine, which causes a problem with passing urine where you have this hesitancy, and it can affect the stream as well. So you see, when you're explaining it in simple language and put it in context with a symptom that the patient might have, then it's easier for them to understand it. So we're thinking about starting a medication. So if you are starting Mrs. Smith on tamsulosin, it's important that we explain about the side effect that it could cause lightheadedness. Give opportunity to the patient to ask questions. So don't just lecture a patient in the management, but it needs to be dialogue. Have you found this video useful? Then you might be interested to watch the next tutorial on consultation models. Click here to watch it. I'll see you on the other side.